Right now, somewhere, someone's holding their jaw at 3 a.m. waiting for the Advil to kick in. That same face was being made in a cave 8,000 years ago. No Advil, no Novocaine, no dentist. Just the person, the tooth, and a truly terrible night ahead. So what did they actually do about it? And when did we stop treating a rotting molar like a demon? The short answer is, they drilled it. 9,000 years ago, in a village in what's now Pakistan, someone sat down and drilled into a living human molar with a flint-tipped bow. It worked. The patient lived. But the real story is what came after, because the fix for a toothache stayed brutal for almost the entire history of our species. Start with Mehrgarh. In 2006, a team led by Andrea Coppa published a paper in Nature that quietly rewrote the story of medicine. They found 11 human molars from a Neolithic graveyard in Pakistan, dated between 7,500 and 9,000 years old, with tiny, perfectly round holes drilled through the enamel. Signs of healing around the holes proved the drilling happened while the patient was alive. The tool was the same flint bow drill people used to make beads, which means our first response to a toothache as a species was to grab a bead drill and get in there. Real talk, that's more effective than anything humans would come up with for the next 6,000 years. Now go to Mesopotamia. Around 1800 BZ, a Babylonian scribe carved something onto a clay tablet, now sitting in the British Museum, catalog number K.2413. It's called the Tooth Worm incantation. Ancient Mesopotamians believed a tiny worm had crawled into the tooth and was chewing it from the inside. A worm that fed on blood and refused all other food. The prescribed treatment was to recite a spell begging the god Ea to smite the worm, then apply a herbal paste. Then, if that failed, yank the tooth. The toothworm theory would stick around unbeaten for the next 3,000 years. Egypt did it slightly better. Around 2600 BC, under Pharaoh Djoser, there was an actual named dental official, Hezri, carrying the title Great One of the Dentists. His tomb at Saqqara still has carved cedar panels bragging about it. About 1,000 years later, the Ebers Papyrus, a 68-foot medical scroll from around 1550 BC, laid out toothache remedies in writing. The main prescription was a paste of ground cumin, frankincense, and carob packed into the cavity. The Egyptians didn't have anesthesia, but they did have flavor. Your toothache would smell great while it destroyed you. Then the Greeks made it about fluid balance. Hippocrates around 400 BC blamed toothaches on black bile, one of his 4 body fluids that also caused sadness, cancer, and pretty much everything else. His recommended fix was to pull the tooth if it was loose, cauterize the gum with a hot iron if it wasn't, and rinse with wine. About 500 years later, a Greek doctor working in Rome named Edius wrote down an actual named tool, the Odontagra, a small forceps designed just for teeth. Which sounds like progress, until you find out most physicians refused to use it because they were afraid of accidentally pulling the wrong one and getting sued. Ancient malpractice was already a thing. Then the Persians figured out clove oil. Around 1025 AD, the physician Ibn Sina, you might know him as Avicenna, wrote a 5-volume medical work called The Canon of Medicine. And buried in there is one of the earliest mentions of cloves as pain relief for teeth. He was right, by the way. The active compound in clove oil is eugenol, and it blocks the same inflammation pathway as ibuprofen. Dentists still put eugenol in temporary fillings today. A guy in 11th century Persia figured out something you can buy at CVS in 10 minutes. He was working from oil, not chemistry. Somehow that made him right for the next 1,000 years. Then came the Pelican. And here's where it gets stupid. Around 1363, a French surgeon named Guy de Chauliac wrote about a tool called the Pelican, named because it looked like a pelican beak, that grabbed the tooth and levered it out sideways. There was no numbing. There was no antibiotic. Your dentist was also probably the guy who cut your hair, because in medieval Europe, tooth pulling was a barber-surgeon job. They set up booths at fairs and advertised painless extractions. Nothing about it was painless. The screaming was part of the show. Roughly 1 in 10 deaths in the Middle Ages was attributed to infected wounds, some of them from tooth work. Getting a molar out was basically a coin flip on your life. And then someone finally wrote it down. In 1728, a French surgeon named Pierre Fauchard published a 783-page book called Le Chirurgien Dentiste. It described cavities, fillings, orthodontics, and the first working dental chair. He argued tooth decay wasn't a worm. He was right about that. He's the reason dentist is a job title and not a side hustle for your barber. 3,000 years of worm theory, ended by one guy in Paris with a pen and a very long attention span. And here's the twist. The worm theory wasn't fully dumb. Modern research shows tooth decay is caused by bacteria, specifically Streptococcus mutans, chewing sugars in your mouth and secreting acid that dissolves enamel. It's a living thing. It really is eating your tooth. The Mesopotamians pointed at the right suspect for the wrong reason. They just picked a worm instead of a microbe because microbes wouldn't be visible until Antony van Leeuwenhoek pointed a lens at plaque in 1683, which is a slightly horrifying way of saying, every ancestor you have was fighting a real invader with a fake weapon. And they were losing, for 8,000 years anyway. Ancient humans handled a toothache by drilling it, cursing it, packing it with cumin, praying at a worm, yanking it with a beak-shaped lever, and finally, in 1728, describing the actual problem. Every one of those people would have traded their entire village for a single bottle of Advil and a numb lip. You have both. You also have insurance you complain about, a hygienist you avoid, and a molar right now that's probably fine. That is the entire deal your ancestors would sign in a heartbeat. Your ancestors would like a word. Now you know, sorry.